in healthcare is to learn about how to deliver or provide patients the needed treatment like medication safely without any consequences that might compromise patient safety. We'll discuss about foundations and concepts. We'll start about definitions about patient safety. And you can ask questions anytime, either by chat or by opening your mic. So just feel free. Okay. So patient safety is a prevention of errors and adverse effects to patients associated with healthcare. My question here, I mean, how can we differentiate between errors and adverse events? How can we, what's the difference between errors or medical errors and medical adverse effect or adverse events? Can anyone differentiate between adverse is the result of error? Exactly. So that's why we always say not all errors have an adverse effects or events, but all adverse effects comes from a medical error. Clear? Okay. So this is what about patient safety. And also we can define patient safety based on the WHO, where they mentioned about the prevention of errors and adverse effects to patients associated with healthcare. Again, this is very important to prevent as part of our role in healthcare is to prevent any errors that would be leading or contributing to adverse events. The system itself, it's very complex in healthcare. As you can see, it's lots of civilization. When we talk about physicians' role, it might be sometimes challenging when they deal with other healthcare providers like pharmacy, nurses, allied health, radiologists, laboratory staff, supply team. All those people are working sometimes in silo and very difficult to coordinate the care plan with them. And basically because we have the human aspect in here. That's why we have to have a system that will govern our practice. A system will ensure that everything will go smoothly as planned without any deviation from the original pathway. We have to think about how can we migrate and also align every single activities along with each others in order to deliver the care efficiently, effectively, safely, as you know, the STEEP concepts or dimensions. Human factors sometimes are very challenging, as I just mentioned earlier. Human, they tend to maybe to forget, to some staff, they are loose. They don't care about their responsibilities. They have problems in punctualities. They have problems in adhering to policies, procedures. They do lots of commission or omission when it goes to medical practice, which consequently it has impacted the patient's safety at the end. As I mentioned earlier about STEEP, we have to think always about number one, what does S stand for? This will be an exercise for you. What S stands for? Safety. And T, we would like to see somebody else. Thank you, Dalal. What T stands for? Timeliness. Okay, thank you, Lean. And E, what does E? Effectiveness, yeah. And E stands for the second E, efficacy. Okay. I would like to correct something about efficacy. It's not efficacy, it's efficiency, in fact. This is what comes from the Institute of Medicine. So the three triple E's, effective, efficient, equitability, and the last one, which is patient-centered care. When we talk about patient-centered care, we have to think about the patient as he or she is in the middle of our attention. We focus on patients. We don't focus on ourselves. We don't focus on the hospital preferences. We focus on what is good for that patient. When you tackle that, you will improve your performance and the hospital performance as well. Because the main customer in the hospital is patients. So that's why we have to focus on patients. When we talk about medication errors, they are fatal, and almost like 7,000 deaths every year, just they are resulted by medication errors alone. And we have to think about how can we mitigate such risk and how can we reduce such number. Those casualties, they did not die because of the underlying cause of the disease. In fact, they died because of our practice, the way we prescribe medication. Maybe it's wrong dose, wrong frequency, wrong route, or let's say the compliance. The patients could also contribute in that. That's why we have to focus on patients' education. How can we train patients to how to take medication at home in order to prevent any death that might be resulted from medication usage. Okay. The cost, in fact, it's high, and it's way beyond 29 billion. Why? Because the statistics was almost like 20 years ago, but now we might double or triple this number up to more billions, and this is the cost of errors. Why? Because of the inflation rate, everything's is actually going up as prices. The cost of errors are also going up. So that's why what you need to remember in here that medication errors costs money, but costs more than money, which is life. Patient's life is also something we have to look at. That's why the Joint Commission, they have established criteria for you how to mitigate the risk of medication errors. Number one, they come up with international patient safety goals, and those goals, we need to remember them by heart. Why? Because they are very basic and very important. If you dismiss one of them, you might compromise patient safety. For example, when we identify patients, we have to identify them correctly. My question to you, how would you identify patients correctly? Give me some hints about how can I identify patients correctly. Any answer? Excellent. MR number, full name. So I'll say Hania and Dalal, both of you, if you say both together, you're correct. If you say only MR number, this is wrong. If you say only full name, this will be a wrong answer. So the correct answer is the full name and medical record number. Why? Because sometimes we have some coincidence where patients, they have the exact full name. MRN number is a unique number, but sometimes we look to the last 3 digits or the first 2 digits, and we get confused with that. And sometimes we overlooked the whole number because we're so busy and very hurry or quickly, we need to do things quickly. So that's why we might overlook some numbers. So that's why we need to think to identify patients correctly by mentioning the full name, patient's name, and the MR number. At this stage, we will be preventing any errors of giving the medication to the wrong patients. Improve effective communication. How would you improve effective communication? Let's say you are a physician and I'm a nurse. I'm going to get your order by phone. How am I, enhancing the effectiveness of our communication, that conversation? Any idea about effective communication? Exactly. We need to, what we call the read back process. Okay. So basically, when a physician gives you an order, before you end that call, you just need to repeat that message. So to confirm from the sender that what has been perceived was correct statement and communicated very well. The third international patient safety goal is to improve safety of high alert medication. How would you improve the safety of high alert medication? Basically, you need to think about where to store those high alert medication. Are they accessed by anyone or only those highly trained staff like pharmacists? Can we prepare medication in site or we have to request it from pharmacy? The way who's going to prescribe, who's going to administer this medication, was he or she trained to do so or not? The fourth international patient safety goal is ensure correct site of procedures, correct procedure, and correct surgery itself. So we need to ensure that we have already met with the patients before the surgery day. We need to do site marking. And during on the day of operation, we have to do time out procedure. Have you heard about time out procedure? What is time out procedure? Yeah, well, no, the check the patient's information 24 hours before. Will be site marking. When you end the procedure, this is too late. Exactly, before the incision, before you do anything. Once the patient is um, in the table, in the OR, you need to check the patients. You check everything, and in fact, everything, will be too broad. But basically, we have to focus on number one, the patient's name, MR number, the site of the procedure name, the performer, and to check if the consent was signed or not. Okay, and we have to stop doing anything in that room. It has to be quiet and everyone focused, and there will be like one reader or presenter. They will say time out, and then they will list every single aspect related to that procedure. And it has to be just before doing any incision. At the end, it will be too late. What if we figure out that this was a wrong patient or wrong site or wrong limb, or maybe this is a wrong procedure? Okay, so that's why we have to do it just right before starting the incision. The fifth one, which is reduce the risk of of healthcare associated or acquired infectious diseases like corona or MRSA or you name it. How? By hand washing, putting signs and labels for those patients who are infected already, so to prevent them from spreading the infectious diseases among other patients or other healthcare providers. Locating those patients in a safe area, which is like negative room pressure or positive room pressure, a single room, restricted visiting time, etc. Reduce the risk of patient harm resulting from falls. This is one of the things that we need and must adhere with, because once the patient is under our is located in our hospital, he will be under our responsibility. We have to protect the patients from falls. We sometimes we might ask for a sitter, and that sitter just to be assisting the patient during hospitalization. We have to instruct the patients. If you need any help, please press the call button. Do not go to a bathroom by yourself because we just given you a medication which might cause drowsiness. So this would facilitate or contribute to fall down from the bed. Always ensure that side rails up in the bed are maintained and secured. These criteria we have to follow. Think about a patient with a brain injury or head injury. They might lose their life just because of a simple fall down. We have to instruct our housekeepers not to keep the floor wet during cleaning. They have to dry it. And we have to put certain precautionary measures in bathroom so the patient will not fall down in the bathroom. So all of these important issues has to be explored by us because down the road, we are the one who's responsible for patient safety inside the hospital. Medication safety can be defined freedom from preventable harm with medication use. And this is by the ICMB, which is an Institute for Safe Medication Practices. I would really encourage you to look at the website, which is posted below, and read more about medication safety. How can we prevent harm contributed by medication administration? Remember, you are the one who's going to prescribe medication. The process starts with the prescribing, which is from your end, and will be transcribing, which is basically transcriptions is not anymore valid at this nowadays because of electronic solutions where we have a CBOE or computerized provider order entry where you don't have to transcribe that medication manually in a small piece of paper for medication administration. So let's say you prescribe, the pharmacist will dispense, the nurse will administer, but you need to monitor. So everything starts from you and end with you in terms of medication process. Monitoring is very important because you need maybe to adjust the dose, titrate the volume or the flow of medication. If it's IV, you might consider alternative solutions or medications because the patient did not respond very well to the first medication. So you need to look for other options in order to provide the needed treatment. Even while you are prescribing, you need to think about look-alike, sound-alike medications. They are very concerning nowadays. For example, if you look at these three embols, each one of them is different and they have totally mechanism of action is different, but all of them, they are white milky solutions. So we have to, and once you put them in an injection, they look like the same. They're almost exactly identical to each other's when we talk about drawing those medication in a small syringe, for example. Okay, these two medications, they're two totally different medications, but the way we color it is almost the same. Everything's the same, but the problem, they have two different mechanisms of actions. This is one of the things that we have to look at it. Sound-alike medication is also, we need to look at it. We have to differentiate among them. And at the same time, we have to keep in mind that those medication could be easily prescribed because of sound-alike. High-alert medications, independent double checking is essential to prevent human error while administering medications. My question to you, what do we mean by independent double checking? Let's say you will have to provide or to give patients infusion of heparin infusion. So what would be the best practice to do it if I say you need to do independent double checking? Two different people and they are on check. Yeah, yes. And here, those two different people really have to use their own calculations. We should not depend on others. Otherwise, we will not be having independent double checking. It will be dependent double checking. Let's say you are a senior, I'm a junior, and I was just listening to you. And when in the end, when you do your calculation, I'll say, yes, I agree with you. No, Muhammad, you need to do by yourself. Maybe I have made a mistake, and that mistake would be, captured by you. So we have to use two mindsets in order to prevent such mistake. That mistake could kill the patients because of lack of independent double checking. Okay, so this is the end, at the end of our presentation today about medication safety. If there is any questions, please feel free to ask. I'll be with you now for questions. If you have any questions, even those questions related to the exam, I'll be happily answering your questions. Any questions from your side? You will come down. Thank you, Fadwa. I have a question for you. Is quality considered to be an accidental effort or an accidental effort? Why is not accidental? Why it's not accidental efforts or plans? Is there any answer for that? Because needs efforts to be reached. Yeah. And those efforts should be not accidental, right? It should be, yes, constant efforts. Exactly. Thank you, Hanuf. They are actually planned efforts. We are not good because constantly it's like by chance we become today good and high caliber and high quality staff. No, because we have a plan. We had efforts where we have already invested for in the back days or months or weeks. So you will not pass the exam just because uh, accidentally you selected those right answers. No, you studied them. It was not coincident. It was planned, and this is like uh, rewarding results because you have already done it through your massive readings and efforts and working to pass your mission or to pass your exam. Okay, this is basically what quality. This is one of the questions where we were asked that about does quality accidental or not accidental. In fact, we should all think about quality as an accidental efforts. They are planned. Okay. This is very essential to understand. I wish you all the best, inshallah, on your journey. If you have any questions, otherwise, we have end our session today. Thank you, everyone. Ramadan Kareem, inshallah, Jameel. Assalamu alaikum.